Welcome to episode 4 of our Dry Eye Educational Series. I'm so excited you could join us tonight, and boy, do we have an exciting evening in store for us. For all of those of you out there, this is your first visit. This is a bit different. Please, we ask you, when you have some time, go back to episode 1, 2, 3. We really set a nice platform talking about dry eye causes and symptoms, and then followed that with diagnostic tools available with episode 2. Episode 3, we really went into treatments. Now we're turning the tables a little bit, and we're going to start when you have all that information and now you have your diagnosis. What do you do? What are you going to do? Okay, how does it work? And so tonight we're going to start a 3-part series where we're going to invite 2 of our expert panelists, our dry eye expert panelists. And tonight we happen to have Dr. Amy Now and Dr. Odell, Leslie Odell, and they've brought with them one of their patients, and we're going to hear directly from the patient their story, their journey of living and managing their dry eye. We have some inspiring information coming your way, and this is a very active, interactive evening. For the first time, we're going to be doing more pop-up polls than we've ever done. We're going to have 4 of them. The pop-up poll is a way for you to engage and interact. You don't have to, it's not mandatory, but it certainly is something that I think you're going to enjoy, learning what others think and learning how others are living with their dry eye. The first one is going to be shortly, just in a moment or two, but as far as how you do it, there's going to be a little pop up here screen that's going to show you. If you're on a desktop, you're going to look at the very bottom there where the arrow is, and that's how you participate in the polls. Just click on that. If you're on a mobile device, it's a little bit different. You're going to see the logo on the top, and then down below in the middle is where those little bars are, where those little pop-up polls are. So what we're going to be doing tonight is we're dividing it into 2 sections. We're going to be listening to the doctor and their patients for the first half, and we're going to start with Dr. Adele and the guest Martha, who I'm going to introduce shortly, and then we're going to follow that with Dr. Amy Now and her wonderful guest also, Debbie, and they're going to be talking about their story. We're going to sprinkle in these polls. The second half of the show is going to be about Q&A. It's your questions for anybody that's involved in this panel. So it can be questions for Martha, who you'll meet, or Debbie, or Dr. Now, or Dr. Odell. This is all about learning how to successfully manage your dry eyes. So with that, let's get started with the first poll. The first poll, if you're going to put up a little, you're going to see it, and you get onto those little bars, you're going to see the first one. We're really curious to know how many years, for all of you out there, how many years you've been managing your dry eye symptoms. So if you can take a minute and the first 2 polls will be up there for about 10-15 minutes, so there's no rush. The second 2 polls, the third and the fourth rather, those are going to come sprinkled into Q&A, so you're going to have like a 5-minute window, so you're going to get some practice time here. So take a look at it, and when you have a minute, fill that out, please. There's also a chat section. If you haven't never used this platform, it's similar to Zoom, but there's a chat area and a Q&A. When you have questions throughout, just sprinkle your questions there. They're going to be addressed at the very end of the show, that second half of the show. But we've got people out there looking at it. They can help you answer questions if you have any technical difficulties. But keep it coming. As it hits your mind, put it out there, and we'll do our very best to get to everybody tonight. And we have a wonderful crowd, record-breaking crowd tonight. So welcome. All right. First poll, do that. Now, with no further ado, I'm going to introduce Dr. Leslie Odell and her patient Martha. And where are you ladies? There you are. Okay, now we're going to get started. Martha, why don't you and you can kick it off, but Dr. Odell, the 2 of you are going to take it from now, and let's hear about Martha's journey.
Okay, thank you so much, Suzanne. I feel privileged to be here, and I just don't want to forget anything that I'm saying. And I don't want to repeat myself, so I will be reading most of my comments tonight. I hope that's all right with you all. I got dry eye about 15 years ago is when my dry eye journey began. When I started experiencing burning eyes, watery eyes constantly. At times they felt gritty and dry and would burn. Over time, I struggled to drive because the sunlight in the day and the car lights at night caused my eyes to water so badly, I had to pull the car over. When this all started, I was caring for my terminally ill husband, and I attributed all these symptoms to stress, lack of sleep, and fatigue. Sometime after my husband passed, I finally began to realize that these issues with my eyes were not due to fatigue or lack of sleep, and I began to look for answers and try to get help. It took nearly a year to come to the realization that I had legitimate eye issues and it would take me several years and 5 doctors until I found relief. My first eye doctor gave me a Schwimmer's test. Did I say that right, Dr. Odell?
Yes, Sherman. That's right.
And he said, well, I need Restasis and fish oil tablets. So gave me that. 9 months later, I went back to see him, and he put in lower punctal plugs to help my tears from evaporating. But when that was not effective, he recommended that I go to another specialist. So I then saw 3 more doctors who did procedures of inserting punctal plugs, removing punctal plugs, recommending expensive procedures that my insurance did not cover. So I went to see one more eye doctor, and he said immediately, "We're getting a new specialist coming. Her name is Dr. Leslie Odell." I was so excited because he was excited. And when I started working with Dr. Odell, my eyes were truly open to the possibilities that I may find relief for my dry eye. I have MGD, and Dr. Odell gave me a plethora of knowledge and experience and wisdom. I was her guinea pig, and I was more than happy to do it because I wanted relief, and I wanted other people to get that same relief. She gave me goggles. Well, didn't give me goggles. She told me about goggles. So I went to the Harley Davidson store, and I got clear goggles when it's cloudy out. I got dark goggles, and notice they have foam rubber so that the wind cannot get into them. And when my husband and I, before goggles, we were at the ocean, he made me goggles out of insulation so that I could be outside with these cool goggles. So I just learned, just take it and roll with it. Also from Echo Eyes, I got these wonderful warm compresses. For 20 minutes, you get to bathe in soothing warmth, and they're wonderful. So there are just so many things out there now that there weren't when I first came. And Dr. Adele, she gave me intense pulse light treatment. She gave me tear care. She gave me LipiFlow. She gave me Blefex. And then she would scrape my upper lids and my lower lids to get the oil flowing. That felt wonderful. The one thing I didn't like, though, was the Meibomian gland expression. That was an ouchie, for sure. So a couple of suggestions I leave with you. Don't dismiss your symptoms. Never give up. There is always hope. Keep looking for the right doctor to assist you through this journey, because I've been blessed with Dr. Odell, no question about it. And you might need more than one specialist. That's okay. If you don't feel like you're getting the relief for your eyes that you need, keep searching. And thirdly, educate yourself. There's so much information out there now. And for example, this wonderful forum we're having now this evening, thank you so much, Suzanne, for having this.
Oh, you're welcome. Martha, that's a wonderful story. So how many years have you been managing your dry eye?
15.
15 years. Dr. Odell, do you see, is that the kind of the, is that pretty frequent when you see people that have, when they get to you that they've had dry eye for quite some time?
I mean, I think 15 years is probably a little bit of an outlier, but she had been seeking care. You know, she was on a path. It wasn't that she was undiagnosed for all that time, but certainly I see patients that are coming to me from other providers that, you know, just like the doctor that she spoke of that was excited to have her see me initially, that they've kind of exhausted what they can. And I think that it's great when you can partner with doctors like that, that will seek out the eye care specialist in the area, the dry eye specialist, and willingly refer, so that the journey can get shorter for the patient. The sooner we can see someone like Martha, the better, you know, for Martha, right? She has less years of agonizing symptoms and you know, not being able to do things that she enjoyed, like going to the beach.
Yeah, that's what, Martha, what are some of the biggest changes that you've seen being able to manage your symptoms, things that you can do that maybe you were unable to do prior to?
Well, at nighttime, I would go to my grandkids' games, but then I couldn't drive home, you know, but now I can. I put on my goggles and I can drive home. Go ahead, headlights, shine in my eyes. You know, these goggles are wonderful. And I just have more of a life now. Wind, bring it on, wind. I walk every day. I didn't used to do that because the goggles help them. But the weird thing is this cold weather that we have right now, my eyes love it. I take my goggles off and they're like slurping it in. I just have weird symptoms sometimes, but just go with it. I drink way more water. Leslie had me do these blink exercises that really help. Sometimes I blink anyways because of the light, and I might end up putting on my goggles before this is over, but it's okay. She just gave me a plethora of arsenal. If this doesn't work, try this. I do a smoothie in the morning. I put all kinds of veggies and fruit in there, like, avocado and things that have lots of oils in. And yeah, I do take fish oil tablets too from Nordic Naturals. They've really worked well for me. So all these things, I'm just so happy.
We just had a question come in, and I thought because you're on there, Martha, it's for you. We were going to save some stuff for the end, but somebody wanted to ask what your protocol is. What is your routine?
In the morning, at night, I put in Refresh PM or Sustain, and they're preservative free. Dr. Adele knocked that into me. Don't get anything that isn't preservative free. So that's been good. And then I have these silicone goggles that I put on at night to sleep. And I have to see through them because that would give me ugh. But anyways, in the morning, then my eyes still feel refreshed. I'm using Sequa right now. That has been amazing for me. And I put on warm compresses to get all the goop off. And then I spray with hydrochloric acid. Is that what it's called? To get all the junk off.
Hydrochloric acid, yeah.
Thank you. Yes. And then at breakfast time, I do really healthy smoothie. And we have a garden outside, so I get lots of fresh fruits and vegetables. And I drink lots and lots of water. Taking a walk in the day whenever I have time for that. Going to my grandkids' games, on the soccer field, you're running back and forth. So those are some of the things that I do.
Wow.
I was just going to interject to say, some of the things that she's doing are so important that we can't do to help control inflammation, within our patients' bodies. And that is taking charge with nutrition and exercise. So nutrition and drinking your water, like you said, and really even just staying active. All of those things really can help your whole body inflammation and that will translate to healthier eyes.
That's wonderful. Is this the protocol that she's sharing, Dr. Odell, something that you see pretty commonly that you recommend? So it's more the lid cleansing, the compressing, the combination, and then it is always in addition to what you're doing, anything in office, right? So it's like an adjunct. It's a partnership.
Right. I mean, even for a patient that has meibomian gland dysfunction, there's inflammation, at play, whether it is aqueous deficient or tear deficient or evaporative with meibomian gland dysfunction. So figuring out what type of anti-inflammatory medication can be a foundation to help reduce inflammation on the ocular surface is important. Then I kind of layer that with, different things. In the case of a patient that's having issues with nighttime closure, that creates a lot of exposure and inflammation that then will carry them through the whole day and make them miserable. From the time they wake up, it's like you never can kind of catch up if your eyes aren't fully closed when you're sleeping. So identifying that has been very helpful. And the goggle that she's talking of is that iSeal 4.0. And for me, a lot of patients like the iSeal 4.0 that is the clear one. I know you have very nice colors, and I do have patients that work like weird third shift and they love the dark opaque, but a lot of people like to be able to open their eyes and still see. And it maybe if you had a little feeling like claustrophobia, that clear just makes it better. But it works great. And even if you don't pair it with an ointment or a gel at nighttime, it really creates a nice humidity chamber for patients to wake up. So that has been very helpful for me in managing patients, is just learning what that lid seal issue was and looking for that in people that I maybe was still not getting where I wanted to be with symptom control. So I'm grateful for that.
Wonderful.
And then, like I said, talking about nutrition, and anytime someone does what Martha does, is being proactive, is taking, doing in the morning and those kind of things, I think is really going to help control inflammation.
Wonderful. Great advice. Well, we have our poll, our update for the first poll. Results are coming in here, and this is really interesting. We have 5% of the audience out there were just recently diagnosed. 60% have been managing their symptoms 1 to 5 years, and 10%, 6 to 10 years, 25%, a quarter of the audience, 10 plus years.
Oh,
So
you're not that unusual, Martha.
I think what's really neat is that there's so many things available today that weren't even available 5 years ago. So it really inspiring, and what you guys have gone through, hopefully many people won't have to. It won't take as long, just given all the tools available and the knowledge we have now as an industry.
I do think, though, that seeking the care and, continuing to find a doctor that maybe is listening to your story and, maybe is doing research in the area can really help. Because even with all the tools that we have, I still meet patients that kind of have lost hope until they end up, in the hands of a, dedicated dry eye specialist. And I, hear that all the time. You give me hope that I can have more comfortable feeling eyes. For me, my goal is to always try to make you have more days where you forget that you have eyes than that you remember. I want you to feel comfortable again in your own eyes. And fortunately, because of a lot of research, I was part of the TFUS Dues 2 initiative, and they even brought a patient into the fold. So I was on the public awareness committee, and they had a patient, and they wanted to hear the patient's voice. I think that, you matter, the patients. I mean, we're working hard to make you feel better. A lot of the doctors that are working for you suffer from the same problem. But the future is bright, and there's a lot that we're learning about dry eye. And so, we have so many more tools than we did, like you're saying, 10 years ago, but I'm excited what the future has to hold, because some of the things I'm still challenged by, whether it's Demodex blepharitis or something like that, I see that there's solutions in the pipeline that are going to really help my patients, which is exciting.
Fantastic. I can't, these go so fast, and we're already at our point where we're going to have to switch to the next one. But this is such wonderful feedback. I'm wishing it was 2 hours. but we don't. We have an hour. We're sticking to the plan here. So what I'm going to do is I'm going to pop up a second poll here, and then we're going to move over and introduce Debbie and Dr. Now, have them come back on. But thank you so much, Martha, for sharing your story with us, and Dr. Adele for all that wonderful advice. The second poll that you're going to see up here, we heard some of what Martha does for herself at home and how different ways that you can manage your symptoms. We're curious to know what of the audience out there, what at-home therapies have you tried, or are you incorporating into managing your symptoms? And some of them would be lid cleansers, moist heat compresses, nighttime shelter, daytime shelter, artificial tears, ointments. And then just the way these things are structured, you can just pick one, but basically you're not trying any of them, 1 to 2, 3 to 5, or 5 plus. So if you can take a minute and answer those, you're going to have about 10 minutes to go through that, 10, 12 minutes to do that poll while we bring Debbie on along with Dr. Amy Now, and we're going to hear all about their journey, Debbie's journey. And Dr. Now, welcome back. Debbie, hello. I think we need to unmute you. Yep.
Do that.
There
we go.
Wonderful. Now I can hear you. Welcome. So happy you're here. And Dr. Now, welcome back.
I'm so glad to be here with Dr. Now, and I was so inspired by Martha's story. And the reason I'm glad to be here is maybe this will give people hope for their dry eyes. While I was at a recent appointment with my corneal specialist, I sat in the examination room, and I saw my diagnoses on the computer screen. And the list read this: blepharitis, meibomian gland dysfunction, aqueous tear deficiency, corneal neuralgia, ocular cicatricial pemphigoid, ocular rosacea, panguecula, and conjunctival chalaces. And that was such an impressive list.
Yeah.
And it's diseases that I never thought I would have to get to know. And these medical conditions have challenged me for the last 10 years. And as I was looking at the list, I thought, this doesn't say everything about me. What was left off of the list is more important than what's on the list. I am so much more than my dry eye. And even though I live with these challenges every day, I still have a good quality of life and I still count my blessings. And I wanted to give you a little bit about my background and how this all started. I was at a routine eye exam and I complained of seasonal dryness. My ophthalmologist said, let's place a punctal plug in your right eye and then you won't need drops. So we did that. And a year later, I had an infection in my tear duct that sent me to an ocular plastic surgeon who cleaned out my duct and said, everything is fine, go live your life. But a week later, my tear duct had scarred over and there were tears just streaming down my face. And that epiphora was torturous, worse than dry eye. I went to another ocular plastic surgeon who did 6 revisions of a surgery and then said, we can't open your tear duct. We're going to need to place a Jones tube, a glass tube in your eye and your nose to conduct the tears. And 2 days before the surgery, I backed out because I felt like it was not going to be a good idea. But all of those surgeries left my eyes excruciatingly painful. And my Schwimmer test said I had 0 moisture in my eyes, and I had gone for lipoflow and had only 5 glands functioning in both eyes that I was supposed to have to maintain for the rest of my life. It seemed pretty hopeless for me. But at the same time, I always felt that I could improve and that I would improve if I just kept going. And at that point, I met Dr. Now, but not until I had seen about 23 doctors who passed me on to the next doctor who couldn't help me for one reason or another. I had tried so many interventions, like many of you who are at the 10-year point. I had done probing, lipoflow, manual expressions, methotrexate for 2 years to reduce inflammation, steroids, Restasis, blephasteam from the UK, autologous serum tears, allergy testing, medical testing, diet changes, and a controlled environment. I was a middle school English teacher who couldn't read. How was I going to do my job? I was a graduate studies professor and I couldn't look at the computer. How was I going to continue my career path? But during those early years, there were a couple of things that really guided me. And one was that I always felt like I could get improvement and I was determined not to stop until I did. And I think attitude is really important for people with dry eye. It can make the difference. And then I decided that no matter how bad my eyes felt, I was going to live my life to the fullest and I wasn't going to let dry eye stop me. And again, I think attitude is the first step to managing dry eye. And I learned from Dr. Now to change just one thing at a time. If you change everything at once, you really can't get a chance to know what is working. And so I learned to be patient and I learned the things that helped me and I wanted to share those with you. The first thing is that change takes time. We all want things to happen instantaneously and they just don't. And I needed to stick with therapy long enough to give it a chance. I tried autologous serum tears, which is they make out of your own blood, and I'm still using them. I tried them 4 times, and on the 4th time, I stuck with it. They burned and they stung, and I felt like they weren't helping at all. But then my eyes started to heal, and my corneal neuralgia wasn't as bad, and my nerves, they regenerated, and it was pretty amazing. And that was the first time that I experienced just take your time. let things work. Nighttime care is critical to the health of my eyes. When Dr. Now told me to use ointment and sleep masks, I couldn't believe the difference. And a couple of weeks ago, for the first time in all these years, I forgot to put in my ointment. And I woke up and my eyes felt so terrible. And I thought, oh, I'm having an acute episode. This is awful. They were gritty and sore. And I realized it was just that I had forgotten my ointment. But I get like 3 or 4 good hours in the morning when I don't have to do anything to my eyes. I do all my computer work then because my eyes feel great from taking care of them at night. Lid hygiene is a game changer for me. I use hypochlorous acid just like Martha. And I remember when the product just first came out, and as I was putting it on my eyelids for my blepharitis and my Demodex, I could immediately feel a difference. And so I do that just like I floss my teeth, once in the morning and once at night. And I don't wear a lot of eye makeup. I do tonight have a little bit on, but I don't want to clog up my glands. And that's important to me. The biggest thing warm compresses, they've saved my glands. I do them in the morning when I get up, and at around 4 o'clock in the afternoon, and I never miss. And when doctors like Dr. Now will say, oh, your oils look really good. And by the way, all my oils are, my glands are open now. So it wasn't just 5 glands for the rest of my life. And I have to keep them open. So I do that with IPLs and with expressions. And I go in every 3 months to have an IPL. And it really has made a huge difference. At the end of the 3 months, I know I need to have another one. But during that 3 months, I'm in pretty good shape. It's not perfect, but it's pretty good. And I know now to stay with a doctor, and it's way better to have a doctor and a treatment plan and someone who really knows your eyes and can help you to manage them and tweak or change the things that aren't working than to travel off to another state like I did at the beginning and get a big idea from somebody but no follow through. And so I just feel so blessed to be Dr. Now's patient. Like Martha, I try to stay hydrated. I drink water all the time. I eat a healthy, well-balanced diet. I don't eat refined sugars, processed foods, gluten, or dairy. And I work with a nutritionist to make sure that I'm getting the right nutrients. But I feel like it brings down all the inflammation in my body. And if I have inflammation other places, it's definitely going to be in my eyes. So that helps. I use clean products on my face. I have been allergy tested. Even last week, 2 weeks ago, I was allergy tested again. I was allergic to my shampoo, but that's really good because I had like 5,000 allergies. Now I only have 2 in the repeat. I've had allergy testing 3 times. So I keep my products as clean as I can and don't use too much around my eyes. And then I blink, but I have to say, Dr. Now, remind me as much as you can about that, because that is probably my biggest problem area. But I build it into my days. When I'm taking my walks, I have different corridors where I blink. If I'm watching TV, I blink during commercials. I just make sure that I have blink times at the computer, because that's important. And another thing is that I believe that I'm here for a purpose, and I want to give back and have gratitude. I didn't want to ever be thankful about dry eyes because it's awful, but it matters how I live. And so I want to show gratitude and I want to give back. And then living life to the fullest. You wouldn't believe some of the stuff that I do. When my eyes were at their very worst, I would go to hula hooping classes on Monday nights in the bad part of town. And when I was hula hooping, I didn't really think about my eyes, and you need a break from thinking about them. And then I learned how to juggle. So I juggle 4 clubs and 5 balls, and I'm in the gym juggling all the time, and people laugh at me, but I'm totally in the moment in this flow where I don't think about my eyes, and that's really helpful. I work out all the time. And I don't think about my eyes when I'm working out. And that makes me feel like I can do other things like take vacations or walk on a windy day with my goggles if I need to, but I can do things, and that's important. And I wanted to end with a story. So I'm a teacher, and I like to keep up with my students. And I had a sixth grader who grew up, and he's a freshman at Wake Forest University. And he's pre-med, taking all these hard classes. And he emailed me and said, would you please Zoom with me over the winter break when I'm home? And so we talked, and he said, you know, I remember in sixth grade when you were struggling with your eyes and trying to be the best teacher that you could be at the same time. And I noticed your resilience, and I noticed how hard it was and that you didn't give up. And that's given me some encouragement not to give up in taking online classes where I never see my professor and I don't have labs, and I'm trying to do these hard courses like organic chemistry and physics. And he said, thank you for being an inspiration. And it made me know that even with dry eye, I can be a blessing to people. I can help them. And I just want to say to everybody, please don't give up if you're struggling with your eyes, because I live with dry eye every day. And it's hard, and I wish I didn't have to have dry eye, but at the same time, I have a good quality of life, and you can too, and I'm living proof of that. And so that's a little piece of my story.
That's wonderful. You are an incredible inspiration. And Dr. Now, what a wonderful thing, right? When you have a patient
why I invited her.
that does stuff. I think compliance, we talk about that, right? You're giving her suggestions, and here Debbie has basically done almost everything. And she brought, I think, a big pearl that you just shared for many, Debbie, was that you take your time, be patient. Do you see that where people just give up a little too soon a lot? You know, the patients just don't, they want the immediate results. Dr. Now?
Yeah, so, you know, especially if you've had this and we're not trying to do proactive care and you're already symptomatic, it's going to take a long time to get better. And Dr. Donald Korb, who's one of my great mentors, often says to people, you know, I can make you feel 25% better in a year. And they kind of, what are you going to do with that? But it's true. You know, you really, if something's been going on for some time, you have to be so patient. You have to let the body heal, and you have to understand that the eyes are connected and they're part of your whole body and health, and things are foundational, like lid cleaning and all that stuff. And we layer things on top of that, but seemingly unrelated items in your lifestyle, such as, you know, hydration and what you eat and whether or not you get enough sleep, and do you exercise or do you sit around all day, mental health, like all of that stuff plays into how you can start to feel better. So it really has to be a holistic and very patient journey that you take if you've had dry eye for a while, but it does pay off in the end if you can stick with it.
That's wonderful. And then today we have, so as we were talking with Dr. Adele too, so there's so many more things available for people to take ownership and do things now that weren't available even 5 years ago. So for those that have been recently diagnosed or 1 to 5, again, it's like, take advantage of listen to what Martha and Debbie are saying, because these things really do work, what you're doing at home in partnership to what you're doing with your doctor in practice. We do have the poll results for the second question we have, which is really encouraging. I love it. So they have 0% of the audience is doing nothing for their home, like what they're doing at home. That is really great news. We've got about 10% are doing, 1 to 2, but 65, almost 66% are doing 3 to 5 things on that list. And that is wonderful. That's really great. And then we have 25% that are doing 5 plus. And that's just the things that you're doing, the simple things like the nighttime, the daytime, the compresses, the lid cleanser. We're going to just take a quick little break here to go to poll 3, which you both, Martha and Debbie, have shared a lot of this, that is important as the regimens, is the lifestyle changes that you choose to make that really can help you feel better on a daily basis. So poll number 3 is really about that, of how many of these lifestyle management changes have you made which would include like dietary changes, which have been referenced several times. The nutraceutical, are you taking those? Increased water intake, blinking exercise, reduced screen time, which we haven't even touched on tonight, but we know that that's a huge factor right now, especially stress management, meditation. So these are going to be the shorter ones. So if you can kind of take your poll like in the next 5 minutes, that would be great. Meanwhile, we're going to go to some Q&A, open this up to Q&A. We've got some great questions coming in right now. Just ask for Dr. Now, what does the future of dry eye treatment look like? What's your perspective?
So I would focus on the future being more preventative than reactive. And so trying to catch people early, I think that's going to be a big sea change in the way that practitioners approach dry eye, as opposed to just giving you drops. Let's try to prevent this from happening. And then I think the other thing that's really a critical piece of the puzzle that we haven't solved yet, but I'm hopeful that we will in the next 5 to 10 years, is irritated corneas. So corneal hyperalgesia, corneal neuropathic pain. You know, when you get into windy conditions and it bothers you, or if you're in a smoky room and it bothers you, that's abnormal. That's abnormal hypersensitivity of the cornea. So you might get a LipiFlow, or you might be doing compresses and maybe you don't feel better. And it's because it's really hard to get the corneas to heal and calm down. So I think that's the next vanguard of where we need to go.
Wonderful, that's exciting. We're going to welcome back Martha and Dr. Odell for a big old roundtable Q&A. Welcome back. I think we're all kind of excited. I have to tell you, there's a lot of things coming in. The audience is really excited. So we had a good question coming up here, which I'm going to ask Dr. Odell. Forgive me for staring at this, but they're coming in via text. That's why I'm staring at this thing. So I'm trying to catch up with them. And I have dry eye too. You never guess. But yeah, wonder why I started the company. It was, gosh, all these great ones. I have tried many dry eye treatments. This is for Dr. Odell. Tried many dry eye treatments and not much luck, specifically in winter and summer. I am considering the sclera lens. What are the doctors, actually it's for both doctors, what are the doctors thinking about using, or what are their thoughts about using sclera lenses? Dr. Adele, you want to?
Well, you know, I think that actually talks to what Dr. Now was just mentioning, how it's so hard to sometimes heal the cornea, and scleral lenses do help us because they help give you a protective shell and kind of protect your cornea while we are trying to heal it. So, you know, I do think scleral lenses are an option for somebody who is not getting relief from, you know, traditional therapies.
Okay, terrific. And then we have another one that we were asking, nighttime topic, which was, what are people's warm compress techniques? So Martha, you were sharing what you were doing with your warm compresses, but we do have a lot of people out here that, you know, it's interesting. How did you get into the routine? You mentioned that you're using it twice a day, Debbie, I think. And did it take some work getting into it? And that people are wanting to know more specifics about how you're doing it. So I'll have Martha, maybe you want to share more thoughts on just how you said you do once a day, twice a day.
Well, it depends how my eyes are, always in the morning and in the evening. This is what my mask looks like. You put it in the microwave for 30 seconds, and then you put it on your eyes like this, and it's wonderful. The warmth just makes your eyes feel wonderful. And also these goggles as well are really well. You put these in the microwave, just these
Yeah, those are, yeah.
This should look familiar to you.
Yeah, those aren't the ones that do go in the microwave. Those are the ones that just you reboil, but that's okay.
Okay.
In the microwave, I don't know what would happen, Suzanne.
Yeah, no, that would not be pretty. So I'm gonna keep on going. We're gonna ask a couple more questions.
Go.
We've had repeated questions about Avenova, specifically instructions on how Avenova is applied. Is it necessary to rub it on, rub it off? And this is for the doctors. Do you guys recommend the Avenova, or you said hypochloric acid several times? So is it just a spray or a wipe, or how?
So it's a spray. It really depends on the person, right? So I have found that it would be great if you would take a Q-tip and really clean in between your lashes because there's biofilms in there. But the compliance isn't always so good. And sometimes people might have a hand tremor, or men, I find, and boys are not so interested in that. So if there's a foamy soap, we'll say, just squirt it on your finger and kind of do this, wash around, and then rinse it off like you're washing your face. I think you have to talk to your doctor. If they've recommended something and it's not working for you, find some way to clean your lids that does work for you, because there's many different techniques. And sometimes patients teach us different techniques as well, but there's lots of different things. So talk to your doctor and figure out what works for you. Sometimes we have people squirt their Avenova, sometimes they hydrate a Q-tip with it. You really just have to find something, but it's very important to clean your lids.
Super. We do have another question about what your thoughts are about lid massage for the doctors. Dr. Adele, thoughts on lid massage and whether you recommend people do it?
So I'm assuming that means after you warm your lids that you are I've seen some recommendations on trying to like push meibum out. I personally am not one to recommend that, just because I don't know, once we warm the tissues there, and I don't know how hard you might be pushing, and so I do not recommend the massage after any kind of moist heat. That's where I think the blink exercises can be helpful. So after you warm with your tranquil eyes, or whatever mask you're using, that you would just do maybe 5 to 10 thoughtful blinks. That helps to kind of get the meibum incorporated into the tear film.
Okay, excellent. All right, and then we have the results for poll 3 are in. So this is the lifestyle changes, and again, we have 5% that aren't doing any, but 23% are doing 1 to 2 things. 55, the majority, are doing 3 to 4 of those changes or things, and then 15.8. So that's really wonderful. So we're going to go to poll 4. The poll 4 is something else that came up frequently today, which was all of these different and really incredible advancements in in-office procedures that are available to assist in dry eye management. So poll 4, and again, it's like, maybe if you take 5 minutes, please, to answer this. It's going to be, how many of these procedures have you participated in? Lid debridement, which a brand would be like Blefx, or if you had LipiFlow or IPL, or there's other things that do like a LipiFlow, like the Tear Care, Ilex, sclera lenses, punctal plugs, prescription drugs, serums. So if you can take a look at that list, and again, just answer that last one, we can get started there. But I think that, do you see what percentage, Dr. Now, what percentage do you see of your patients that need some kind of in-office procedure to go along with it? And I guess it's kind of a broad question, because you're primarily seeing almost all dry eye patients.
So we try to be data driven. So we look to see if they want to have do they need a lid cleaning procedure specifically? We try to assess the function of the glands by pushing on it with a little instrument, or sometimes our fingers, or a combination, and plus meibography, so taking a picture of the eyelids. And if you have atrophy of the glands, that's a late stage finding. That's the end. And you may not be that symptomatic, but you should be treating way before you have atrophy. So, I treat my teenage kids. I sort of feel that really, it sounds aggressive, but I don't think it is. I think if you were on a screen for more than 6 hours a day, 5 days a week, you probably need to have a LipiFlow or a Tear Care or something once or twice a year to maintain your glands, in addition to home therapy. And that's the preventative part.
Okay, very good. Dr. Odell, any additional thoughts?
No, I would definitely agree with what Dr. Now just said with the digital devices. I actually completed a research project not too long ago with a doctor that treats a population of people who don't tend to use electronics, actually the Amish population in Lancaster County, Pennsylvania. And we found that 2 hours of digital device use impacted the meibomian glands. Wow. So, I think what she's saying is spot on. You don't need to be on a device for very long for it to have some negative impacts.
Yep, and that actually lends to another question too about age, like the the prevalence of MGD and dry eye becoming lower and lower in age, like you're seeing it in your 20s now and adolescence even. So it is something where all of the stuff that we're talking about tonight, it's really real, no matter, regardless of how old you are, really, you know, if you're an adult, because of our environment, lifestyle, and physical condition. Another one that we've had, this came up in one of our other episodes, we've got an overwhelming number of people asking for examples of what the blinking exercises are. So maybe the patients, why don't Martha and Debbie, let's start with you, Debbie. You want to show how you do your blinking exercises?
Well, I learned again how to do them on this webinar, but Dr. Now has helped me all the way through. And so I don't want to squeeze the muscles of my face, and I want to have good complete blinks and just a little squeeze at the bottom, but pretty natural, and then open. The complete blink is what is very important, and the little squeeze at the bottom, just like that.
Okay, excellent. And there's a reason for that, right, Dr. Now, as far as the amount of pressure and not wanting to go like that, like squeeze really?
Well, yeah, so if you're engaging your face going like this, you're not blinking, you're just squeezing out here. And so you're not expressing anything. So there's two things that's important about the blink. Everyone talks about the meibomian glands, which are so important because there's muscles that go around the glands, and on the complete blink, they squeeze the glands. But the other thing is that there's a reservoir of tears, of liquid tears behind this lid. And unless you make a complete blink, you can't take that tear from that's behind here and drag it up onto the surface of the eye. So you see a lot of dryness right at the bottom when people do partial blinks. So it's a combination of expressing the meibomian glands, but also fully hydrating the ocular surface. So it's really critical to blink. And you also don't want to squeeze really, really hard repeatedly, because there have been a couple papers that show that there's some corneal epithelial damage, surface cell damage by just really hard blinking. You just want to look normal. You know, you just close your eyes. You should feel the two lids touch, little pause, squeeze, and then open.
Excellent. Dr. Odell, I know you highly recommend them also. Is that a standard for you for blinking exercises for your dry eye patients?
Yeah. Yeah, but I think that it's definitely important, just like, you know, Dr. Now was saying, and the tear distribution is a big part of that. So I would agree with what she had to say.
So for the ideal person, like how frequently would you want somebody to be doing blinking exercises during the day?
Well, I tell them to just do it throughout the day. So don't make a big project out of it, or you'll never continue to do it. So I say be Pavlovian, you know, when you do something during the day, remember to blink. It's drinking water, eating, every time you go to the fridge, you go to the restroom, you get a text, you're at a red light, you know, something that just happens consistently throughout your day, and you say, oh yeah, I have to blink when I do that.
Got it. Another question here. We have, what technique device is best to use in place of LipiFlow for those of us with thyroid eye disease and resulting ptosis? LipiFlow inserts do not fit those of us with such orbital damage. Either one of you want to comment on that, Dr.?
Well, I mean, it's hard to be specific, you know, to any patient, but I will comment on LipiFlow activators not always being one size fits all. But I would say, you know, I've been using LipiFlow since 2012, and I can only really think of one patient that I was unsuccessful at, a very petite patient with a very small like orbital fissure. It was really hard for me to get the activator in. But aside, you know, so in that case, I kind of lean toward any other way that I could heat and do expression, whether it's something like Tear Care or iLux, or that might be where something like IPL could be very beneficial.
Okay, super. Okay, and we have, let's see, eyelids are itchy, bad. Is there medicine to stop the itch?
I think you have to figure out why it's itching. And a lot of times it could be allergy, but it's probably Demodex mites, or just the lids being really dirty. And so 9 times out of 10, that's what it is. Go to your doctor and ask them, you know, what's going on. and
Yeah.
then stick with it, stick with the therapy. But a lot of times it's because the lids are dirty and many people have mites.
Got it. There's so we have our poll 4 coming back in here, which is how many people have been doing things in office. So 0, this is the highest. 28% haven't tried any of these in-office procedures. So it goes back to having a really good conversation with your eye doctor about things, proper diagnosis, what is available. The 32% 1 to 2, 30% 3 to 5 of them. Almost 10% 5 plus. So those might be the folks that have been managing their disease for over 10 years. Another question, how is Sjogren's and MGD and inflammation related? So as it relates to the dry eye, do you want to, let's see, maybe Dr. Odell?
Sure, and I'm sure that Dr. Now will have something to add, and I
Yeah,
would
both you.
read that for you too, so jump in. But, I think that notoriously Sjogren's was thought to be an aqueous deficient disease, right? You can't produce tears, that related to inflammation. But some of the more recent research shows that Sjogren's patients are also significantly impacted by meibomian gland dysfunction. So it's not like these two things are separate entities. They're blended together oftentimes. And that is something that a Sjogren's patient needs to address is, not only the tear deficiency that is part of that disease, but also the oil gland problems that we see along with that with meibomian gland dysfunction.
And I guess, Debbie, you talked about your journey you have many things going on, which lots of people do, but, if you have anything to sort of say about that as a patient.
I just think the little changes can make a big difference, and to stick with those therapies that they might seem trivial, but they actually do make your eyes comfortable. I came back from the most incredible pain, and I never thought that I would. But my eyes are pretty good, and it's just the things that everybody says they're doing, from the polls. There's nothing magical about it, but I do think the IPLs are the most important thing of all for me.
And that brings up another interesting thing is that we've talked about it a lot in all these episodes, that there is no one thing, that will work for everybody. You really do need to go through the process of trying these things and being committed to figuring out with your doctor what works the best for you, because every human body is different. People's lifestyles are different. Their environment is different. Physical condition is different. So I think the real silver lining here is that there really are so many options available, and that it is this partnership of really working with your doctor to find what is right for you. And that's super.
I think just real quick to just add one thing to that, Suzanne, is that, many times we meet a patient that wants to know, why is this happening to me? What did I do wrong? What's the one thing that I did? And you're exactly right. It's not one thing that anyone has done. It's a multitude of things that have just kind of created the perfect storm to get them to the point of symptoms. And because of that being so multifactorial, your disease management and our treatment plans that we have to work with you to build are so unique. So I couldn't give Debbie the same treatment plan I gave Martha, and that's why we can't even tell people that are tuned in tonight, to do X, Y, or Z, because it's such a, unique plan for each patient. One person might be, environmentally challenged with, airflow and things like that. Another person might be spending a lot of time on a digital device, or, another patient might be wearing cosmetics that are really fueling their fire. So it's really challenging. And I think that's why Dr. Now and I, enjoy what we do so much, is just, it's challenging for us to put the puzzle together, and we are rewarded by giving you those better days, more comfortable days in your eyes. So and that's why sticking with one doctor is important too, because if we're trying different things and you are jumping around, then you never really get to your resolution. Like you were saying, Debbie, when you have a doctor that's vested in your well-being, it makes all of the difference.
Wonderful. That's great. There, anything with one of the other things with on the patient side too, when you, maybe we can ask, what were did you have some aha moments when all of a sudden you really did, it was like you were trying things maybe, and I'll go to Martha on this one, that you, after, I think, because we were just talking about in-office procedures, sometimes that can take a while, you know, because so you do it and you have to do it repeatedly, as Debbie has mentioned with her IPL. So was there an expectation that was associated with these in-office things that it would be something that would feel really good immediately? Was there a learning to it? Did you have to do it repeatedly, Martha?
Some of them felt really good right after the procedure was done. And then Dr. Odell would say, well, we probably should do this again in like 3 months. I don't know exactly what that was, Dr. Adele, but yeah, it was, I think IPL was really good for me. I had a couple of them. I think I had that recorded. And I didn't have any expectations because for so long I had been struggling just little by little. And so I guess I didn't expect a lot. So it was a nice surprise when things worked.
Yeah, there you go. Don't give up.
Yes.
And see, how about yours? With yours, did it take a while, or was it kind of an immediate thing with the in-office procedures that you were doing? And there were some questions too about the surgery that you had, but you opted out of the surgery, right? You had the pump plugs, but you opted out of the surgery.
So I had 6 surgeries to try to open my tear duct, but I didn't go through with the Jones tube. I remember going into Dr. Korb's office though, and him suggesting little changes, and I was thinking, well, how are these little changes going to make a big difference for somebody who had so many things going on with my eyes? But the compliance piece, I'm always willing to go along with whatever is asked of me from a doctor, and it just paid off so much. I'm an online teacher now. I teach 5 online courses for my graduate students because of the pandemic. And, you know, I can do that, but I have to be smart about it. I have to take breaks every 20 minutes. I have to do my blinking. I keep a filter on the computer. But things that I'm doing now, I never thought I'd do again. And I was told by doctors that I would never have this kind of functioning. But when Dr. Now says all your glands are open, or a good majority of them are, it's like a miracle. And it was the small things. It wasn't the big things that made the difference.
That's wonderful. There's another one is coming up here, several on, you know, because it's winter time and there's a lot of big storms going in a lot of different directions. And just the people want to turn on those heaters. And as somebody's asked, of course, but, you know, does that make it worse? Do heaters make it worse? So maybe we can talk about the environmental impact of whether it's air conditioning in the summer or the forced air heating in the winter time. Dr. Now, you want to kind of share with the audience those that the impact of humidity in the ocular surface or absence of?
Yeah, so if it will dry your laundry, it will dry out your eyes, basically, right? So low humidity or wind currents, you know, that's going to increase evaporation from the ocular surface, especially if you aren't blinking and if you have poor tear film retention from something like MGD. So yes, so get a humidifier. We often recommend desk humidifiers or putting humidifiers in your house. It helps a lot.
That's great advice. And then watching the fans in the summertime, right, over the beds, fans, and that goes back to a lot of folks that are having those issues, especially at night, that having some kind of shelter at night helps them out a lot. Mm-hmm. Having a hydrating mask to wear, because then they can keep the fans going.
And it saves marriages, actually. You know, like the one person wants the fan on, it hurts someone else's eyes. Get a sleep mask. We're good to go.
Oh, that's funny. Oh my gosh, it's hard to believe, but I've got to wrap up. It's already 5:59. I just can't thank you all for being here, and especially Martha and Debbie sharing your stories, and for Dr. Now and Dr. Odell for all the work you have done for all these decades serving dry eye patients and doing well above what so many have done, and you're just saving people's lives out there. So thank you so much. We're going to wrap it up here. We are looking forward to doing this again in February. So it's going to be February 25th, Thursday, same time, 5 p.m. Pacific Standard Time, 8 p.m. Eastern Standard Time. And with us in February is going to be returning Dr. Laura Perriman and Dr. Crystal Breimer, and they're also going to be bringing a patient each, and we're going to do the same format, and we're looking forward to having you join us for more stories, sharing more information about how you can successfully manage your dry eye at home and in office for a higher quality of life. So thank you so much for joining us, and I hope you all have a wonderful evening.